saw the short clip from a famous movie showing a doctor dying on the street, helpless, without any medical attention. Unfortunately, it is happening even today. 30% of the patients with heart attack die on their way to the hospital even today. There's only one strategy which can prevent it, is your awareness that whether you have a heart disease or not. How do you know whether you have heart disease? If you have family history, your father, your brother, or your uncle, or your grandfather, direct blood relations, anybody has had heart attack or stroke, then you are susceptible. If you are diabetic, if you are hypertension, and if you are a smoker, smoking in fact increases the risk of heart attack at least by 35%. And the only way to know this is by regular checkups, and be careful between the age of 35 and 40. It's in this age group when you are at the top of your game, you are in the prime of life, and you are at the peak of your career. You suddenly face a heart attack and your life either changes forever or you're dead and gone, leaving the family in a lurch. Just the wrong time to die. So CT angio has been there in the market, in the business for a long time, since it first came to Calcutta in 2005, 2006, and I've been involved with them from the beginning because I had a bypass surgery at the age of 41 in 2003 when there was no such equipment available. And I had a bad family history, used to do the checkups every year. Every year is to walk the treadmill, complete the 10 minutes, and there were absolutely no issues. Finally, in 2003, when I was doing my annual checkup, 2.5 minutes on the treadmill, I suddenly started having a heart attack. And then I had to have an emergency bypass. The trauma my family went through, I don't want anybody else to face the same situation. The way to prevent heart attacks is to take the corrective action in time. Cardiac CT, this is one of the most powerful instruments available to us in preventing heart attacks and untimely cardiac deaths. There are two parts to it. One is a plain scan. It just takes 3 or 4 seconds of your time, and we know that how much calcium is deposited in the arteries. Then if we find that some calcium deposition has happened, you have disease, then we would like to see your blood vessels, coronary arteries in detail. And then we do the main, but this is also a non-invasive examination with minimum radiation. We just put in an IV catheter and give you IV contrast, and you have to be in the machine for 7 seconds, and all your coronary arteries, all their blocks, all what you have eaten over the years and what the results have been are available to you within the next 15 minutes. So don't hesitate if you are at risk, if you are between 35 and 40, if you have diabetes, if you have hypertension, or if you have a family history, or you are a smoker. Go and talk to your GP, talk to your family physician or your cardiologist, and get yourself a prescription for a CT angio. It's as important as the life insurance you pay, because this definitely prevents heart attacks and strokes and death at the most inopportune moment of your life. Take your medication on time, prevent heart attacks, have a happy life.